The information on the contamination is confined at the present time, as there ought to be a ton of study before it is totally grasped. In the meantime, information is power, so this once-over contains 10 things you should consider COVID-19 and how best to shield yourself from misinterpretations, mixed-up presumptions, and unmitigated media lies about it. This information is just a look at something bigger, so keep awake with the most recent on scenes in your general region from real sources, and everything should be fine. What is a coronavirus? COVID-19 is a coronavirus, which implies next to no to a great many people who don't work in virology or immunology. A coronavirus is a gathering of infections that contained warm-blooded animals and winged animals. In people, they can cause respiratory tract contaminations, a significant number of which can be treated with over-the-counter prescription. The supposed regular cold is the aftereffect of a coronavirus, and keeping in mind that most are surely known and infrequently in excess of a bother, some can be deadly. COVID-19 alludes to the episode of the sickness, which is separated as coronavirus illness 2019. The infection itself likewise has a name, yet it's somewhat of a significant piece: extreme intense respiratory disorder coronavirus 2, or SARS-CoV-2. Some portion of that abbreviation might be natural, seeing as the world previously experienced a comparable flare-up of SARS in 2003. The infections are connected, and it wouldn't be not feasible to call this new flare-up SARS 2.0, however you likely won't hear any expert virologist state that in the media. In any case, COVID-19 is a coronavirus, and it is spreading. However, that is not a reason to worry, rather, it's a reason to get ready and ensure ourselves similarly we do when it's cold and influenza season. Where COVID-19 started. It's notable that the infection was first found in Wuhan, China, however, it's not completely seen precisely where it began. COVID-19 is likely a zoonotic infection, which implies it very well may be transmitted among creatures and individuals. This has driven analysts to search for creatures that may have initially conveyed the sickness. There are a great deal of similitudes between COVID-19 and two bat-inferred strains of beta-coronavirus, which implies they are likely related. Since the infections share about 96% of similar qualities, it was at first accepted that bats were the wellspring of the episode, which was pinpointed to the Huanan fish market, where intriguing creatures are sold. As time went on, and more research was led, Chinese specialists had the option to establish that COVID-19 shared 99% of a similar hereditary data as a comparable infection that contaminates pangolins. This recommended pangolins may have been a middle person have for the infection, however the examination wasn't authoritatively distributed, and a significant part of the investigation remains unconfirmed, for, while deciding the exact inception may assist virologists with bettering comprehend COVID-19, doing so isn't completely important in combating the spread of the sickness, since it's been discharged into the human populace. How COVID-19 is transmitted. Since the principal day the world found out about the Wuhan coronavirus, its dread spreading started to rise. How was it transmitted, and what should be possible to constrain its transmission? Individuals have consistently dreaded Ebola, yet that is far harder to get than something like a coronavirus, and it's everything about what it taints and how it is transmitted. COVID-19 causes a respiratory disease, and it's through an individual's breath that it spreads the most effortless. There are two known methods by which the infection spreads, individual to individual and through contact with tainted surfaces. In an individual-to-individual circumstance, the infection can be spread through close contact, which is commonly viewed as a separation of 6 feet. The manner in which an individual can pass it on is through respiratory beads, which are created when an individual hacks or sniffles. Covering one's mouth when this happens eases the spread of the sickness, and tainted individuals should wear a face mask to lessen the danger of transmitting it to another person. In any case, it would be ideal if you regard the top health spokesperson's warning 6 and don't purchase a cover except if you need one. The other way it is spread is through a surface defiled with the infection. A lead could have been in the pathway of a sniffle, which conveyed COVID-19 to its surface. Contacting that, and afterward contacting your mouth, nose, and conceivably the eyes can bring about disease. How COVID-19 is identified or affirmed. Probably the greatest issue with recognizing COVID-19 out of a patient is that it presents a lot like the normal virus. To battle this, scientists over the globe have been scrambling to think of an approach to test for the nearness of the infection, and this has brought about a few distinctive testing strategies. Probably the most ideal approaches to check for the infection isn't to check whether you can discover the infection in an individual's body, it's to discover the antibodies the body produces to battle the disease. The tests that search for antibodies are called serological tests, and a firm in Singapore may have idealized a methods for directing this kind of test to discover COVID-19. Immune response tests are most likely the quickest and least demanding method for identifying the nearness of COVID-19, yet it isn't the main way. There are tests at present being utilized far and wide, which search for the infection's hereditary data in an individual's spit, mouth, nose, and butt. These tests utilize the polymerase chain response (PCR) technique, which is a procedure in atomic science that quickly creates billions of duplicates of DNA for study. While these tests can recognize the nearness of COVID-19, they can't distinguish individuals who were tainted and eventually freed from it. Who is in danger? There is no known insusceptibility to COVID-19, which implies that everybody is in danger of getting and spreading the contamination. That doesn't mean this is an ideal time to freeze, since you may get tainted, doesn't mean you're going to fall over dead in a couple of hours. COVID-19 can be hazardous, however, like most diseases, certain segments of the populace are more in danger than others. Small kids, social insurance experts, the older, and individuals with an undermined insusceptible framework are the ones who are most in danger of getting truly sick from COVID-19. At the point when a solid grown-up gets the infection, there's a likelihood that they won't show any side effects whatsoever, and won't become ill. This is one reason the infection has figured out how to get away from the bounds of Wuhan, China, to contaminate the world. Tainted individuals who are asymptomatic become obscure bearers, and in any event, when and in any case solid grown-up shows side effects, they are frequently gentle and similar to the basic virus. What are the side effects of COVID-19? The initial segment of this square is going to list the side effects related with COVID-19 that shouldn't frighten anybody, yet the last piece will be about the more hazardous parts of the infection. Try not to be frightened, as these are the most pessimistic scenario side effects that won't influence a great many people who are contaminated. The most widely recognized side effects of COVID-19 are fever, hacking, and brevity of breath. These are similar side effects the vast majority get from the basic cold, yet they are the mildest potential side effects an individual can understanding. For the individuals who are under a more noteworthy arrangement of hazard because of an undermined invulnerable framework, or meet the criteria recently referenced, indications can become undeniably increasingly extreme. COVID-19 can expand the odds of contracting pneumonia, it can cause numerous organ disappointment, and now and again, it can bring about death. These are the most extreme cases, however all are of worry because of the straightforwardness by which it tends to be transmitted from individual to individual. COVID-19 mortality concerns. Indeed, COVID-19 can take an individual's life, however that doesn't mean the world will wind up as it did in Stephen Lord's The Stand. The death rate for COVID-19 is assessed to be 2.3%, and keeping in mind that that number may appear to be low, it's most certainly not. On the off chance that you think about the death pace of COVID-19 to something progressively regular like this season's flu virus, it's extensively higher. This season's cold virus has a death pace of 0.1%, which sees a normal of 1 passing for each 1,000 individuals. These numbers are resolved by means of the case casualty rate (CFR), which thinks about the all-out number of tainted patients with the individuals who surrendered from the infection. While COVID-19 is a lot higher than this season's flu virus, it presents as a gentle disease in most by far of individuals who have had it. Most of individuals who have kicked the bucket in China have been old, and investigations of passings from the infection show that the CFR bounces to 14.8% for individuals who are 80 and more established, while those between the ages of 70 and 79 have a CFR of 8%. For individuals who were at that point fundamentally sick when they interacted with the infection, that number bounces to 49%, recommending they are the most helpless individuals from the populace. Abstain from getting tainted. Listverse distributed an article on top 10 things you have to do to get ready for the coronavirus, yet this was expected to be a greater amount of an apocalypse-type situation, so think about it while taking other factors into consideration, of which there is a lot to be found in the remarks on that rundown. Truly, there are steps you can take to abstain from getting tainted, and risks are you've been doing them from the start. Since COVID-19 is a coronavirus, which is passed similarly as a typical cold, the most ideal approach to shield from getting it is to wash your hands with cleanser and warm water, abstain from contacting your face in the wake of coming into contact with anything usually utilized like door handles, and on the off chance that you need to head outside, attempt to maintain a strategic distance from wiped out individuals. Chances are, you do the entirety of that as of now, so you don't need to let COVID-19 overturn your life or your daily schedule. On the off chance that you have worries about ending up in a spot with a great deal of possibly tainted individuals, you can abstain from venturing out and going to occasions with swarms, yet that may not be important. In the event that it causes you to feel better to wear a face veil, you can do as such, yet ensure you get the correct kind. The U.S. Nourishment and Medication Organization perceives 4 off-the-rack N95 respirators, which might be compelling in halting the spread of COVID-19, 3M particulate respirator 8670F, 3M particulate respirator 8612F, Pasteur F550G respirator, and the Pasteur A520G respirator. These respirators are not reasonable for youngsters or men with facial hair, so it's time so bid farewell to that unexpected trendy person whiskers. COVID-19, HIV, and other fear-inspired notions. One reason there are such a large number of fear-inspired notions about infections like COVID-19 is that couple of individuals genuinely get it. Ideally, this rundown will help with that, yet there are individuals who hear a remark like, this infection may utilize the pressing instruments of different infections, for example, HIV, and their minds will in general go out of control. That finding was distributed by researchers at Nankai College, and it's valid. The infection has a HIV-like transformation, however that doesn't mean somebody weaponized a type of HIV in a lab someplace and discharged it upon the world, as some fear-inspired notions have expressed. These equivalent instruments show up in numerous maladies as the aftereffect of normal transformations. That comment has an inseparable tie to the methods for battling the spread of disease, and research like this assists push with encouraging exploration, which could ideally prompt a fix or antibody. You may have seen other paranoid ideas, including one about another 5G remote framework being the reason for the infection, however this is so incredibly bogus, it scarcely merits notice. The most significant activity with regards to hearing these accounts is, inquire as to whether they bode well, check whether they are distributed by trustworthy sources, and adopt a presence of mind strategy to anything you hear. What to do in the event that you believe you're contaminated with COVID-19? The absolute first thing you have to do is recall the words imprinted on the front of the Drifter's Manual for the Universe, which are, don't frenzy. Freezing doesn't support you or your friends and family, so you have to deal with yourself to guarantee you don't spread the disease and ensure you get the correct consideration. In the event that you build up a fever alongside side effects of respiratory disease, you should call your human services supplier and request their recommendation. They will realize the correct inquiries to pose to help decide whether you have the normal cold, or on the off chance that you have something more serious. If you dread you genuinely came in contact with somebody contaminated with COVID-19 and are concerned you may have it too, you have to get tried. Since you are going out to get checked, be mindful, and keep your mouth and nose secured. This will shield you from passing the infection to others, so on the off chance that you have a respirator or careful cover you can utilize, do as such. If not, you can utilize a scarf or comparable piece of clothing. Your neighborhood emergency clinic may not yet be outfitted with testing packs for COVID-19, so call your nearby general well-being office for data on the best spot to go.